welcome our special guest, Babette Gekeler. Babette Gekeler, as I said before, is a research fellow at the Institute of Medical Psychology at Charité and a psychotherapist in training and assistant lecturer at the Humboldt University. She furthermore founded the Working Group for Psychological Health at the Network for Refugee Research, where they're working on connecting interdisciplinary research on this topic in Germany. But perhaps you can tell us a bit in your own words what you're doing, especially at the Network for Refugee Research. So you can tell it better than me, I think.
Hello. Is this, yeah. Hi, yes, first of all, thanks for having me here, for inviting me. And yes, at the network, we're particularly interested in looking at drawing together research performed in Germany that brings together an interdisciplinary approach to the ideas of trauma and mental health of traumatized youth and adults, which means that, as I think we could quite nicely see in this film as well, that if we simplify the term trauma and we just think of trauma as that one thing, that one trauma that exists, it doesn't make much sense in reality, and it won't help us devise the right treatment for our patients, because every life is so different, every experience is very different, every motivation to leave a country in the case of refugees is very different, and there are people doing great work in putting together very complex perspectives on ideas of trauma, and we're trying to get that a bit more into the mainstream, to move away from the idea of a simple diagnosis of trauma.
So how does it manifest itself during the flight and after it, and how do these people cope with their suffering?
Okay, so as to the experiencing of trauma, I think we can quite well say that the journeys, the trips on the boat that the people are experiencing are always highly distressful. So for everyone, this is a highly stressful situation, and during flight, we as humans have a physiological reaction to stress, which means we have an increased heart rate, we have narrowed pupils, so all of this happens in order to focus our attention to actually be better in performance and survival, and this is a very important survival strategy, which makes us during flight actually not experience the effects of the stress. And most people during the flight situations are focused very much on that. I think we could see in the movie where they were interviewing the adults and the boy about the actual trip. The grown-ups seemed more distressed than the boy, the little kid as well, because everything is focused on the moment, but the kid was having his father nearby, and he was able to sleep in his father's arms during the boat trip. So I mean, the concentration is on survival, on the basics, and is it provided or is it not? And that what happens during after the flight, and why the situation in those detention centers is so dramatic as it is and as we have seen, because now we're starting to realize our normal cognitive system starts to switch on again, and we are able to foresee a future. We are dealing with what happened. We are anxious again, anxiety. We are thinking about what we left behind and who we left behind, and how we're wanting to look into the future, and all these things seem very dire from these vantage points. And also, which I think is really important in terms of coping, a lot of studies coming from psychology show that if you have no ability to feel in control of your own life, if you feel lack of self-efficacy, that has shown to be highly linked to depression. So situations where people are put in places where they are locked up and they have experienced such hazardous journeys in order to move forward, to change their lives, and are then put in a situation where they cannot do anything. They actually not only taken away the ability to work or to do something, but they really feel they have no more control over their own lives and their fate. And that causes a lot of psychological distress. Because both future planning and past and the motivation to even engage and embark on a journey like this is now being put in question.
Yes, they said many people won't do that again. They say they won't do it again. I mean, everyone can understand having such a trauma.
Yes, and again, I think here we have to differentiate why people are leaving in the first place. I think we haven't heard much in the interviews of the protagonists about their motivation to leave the country. We know they have all been talking to family members or contacts to go, but what actually led them to go, we don't really know. In this case here at the moment, obviously in Berlin we're now, and I'm in my both work at Charité and practice talking a lot to Syrian refugees, and this is a different situation again, because it might be a similar outcome of trauma, but the motivation of leaving a country has been very different. These people have fled war, they have taken their children out of life-threatening situations. So there were no. So again, it puts a different perspective on the whole journey.
Said the other way around, but I think seeing those people, it was rather the way you told me, that the adults are still struggling with the experience, and the boy, I mean, of course he cried and he, but I don't know if we can actually say does his brain change or something like that. So you've spoken to many refugees, I think, and so your experience is more than like the adults are the ones who need help.
So first, I don't think the adults need more help than the children. I think the children do need help as well, in case of severe traumatization. But yes, I do also tend to disagree with that one statement by that psychiatrist, that the children's brains are then set if they have gone through this experience. Of course not. I mean, we have the most flexible brains, and particularly during development, our brains are adaptable and changeable, and that goes way into adulthood and actually way into older age as well. It slows down dramatically. That's life. But no, it's not the case that children. These experiences, obviously, they are part of these children's lives, and they will not forget, just as much as the adults will not forget. But what she was saying is correct. And I mean, out of the children, we are now conducting a long-term. We're planning a long-term study of mental health in refugee children here in Berlin. So we're looking at Syrian children in preschool age, and we want to look at their mental health and their neurophysiological health, aspects to their mental health, and we're interested actually more in the resilience of these children than in the negative outcome of the trauma, because we do see an assumed third. We haven't got clear figures yet, but 1/3 of between 25 and 33% of children, refugee children, showing signs of post-traumatic stress or intense distress. However, that means that 2/3 of children are actually coping pretty well with what they've gone through, and that's the majority of children. And we're quite keen on seeing how these children cope, because that will make us more informed about what we can provide and what we need to provide. We're focusing on a very small amount of people who are not coping well with their trauma and who will need psychological services, and and therapy. But I think what's not talked enough about is how many people actually cope pretty well, and we also have to remember that those people who leave their countries, they're usually the strongest ones. The ones that are leaving to embark on this journey are those most resilient of people in a country. So the people we're seeing here, the people who are coming here, are already a selection of population who are very strong and healthy and determined when leaving their country. So I'm not surprised about the figures that most of them are coping pretty well.
How can we help, or what should we do to make these people, help them to cope better with their situation?
I think what's really important is that we have contact. There's a very important theory in psychology, it's called integral contact theory, and it says that contact, it's a pretty simple hypothesis that more contact reduces prejudice, and that's been found to be true across many studies, and we've seen that this is particularly true for emotional measures such as liking. So the more contact we have with other groups, the more we like these groups, members of these groups. This is not so much true for, interestingly, stereotypes, for example. So we can have a lot of contact with other groups. Our stereotypes of these groups will remain generally the same. So we can have Italian friends for 20, 30 years, and lots of them, the image we have of Italy and our Italian friends are, the stereotypes remain the same, but our liking of these groups then can dramatically change. And I think this is very important for us as society to know, because that means the more we engage and the more contact we're having, the more we can increase liking and then counter the negative stereotypes. This also means that this should happen pretty fast, and the faster the better, before those stereotypes manifest in our heads. Because once they have manifested, then we'll get less likely to wanting to engage. We get more worried, we get more concerned, we start to have barriers that we don't know how we should get in contact with these people. They already become these people, like I just expressed it too. So I think it's really important to be building contact as fast as possible. Now in the media landscape we're living in, I think it's even more important that we're engaging in this, and it's also important to not have these processes stopped through stereotypes.
So the breaking up of the families, the travelling by boat, by land, what are the things that have the most impact on you?
In order to really develop a severe post-traumatic stress syndrome, you have to assume that the intensity, we look at two factors. We look at the intensity and the amount of stresses that a person is exposed to. So the more intense the stressor is, the more likely a post-traumatic stress reaction will occur, and the more often it occurs. So the newest theories now say that in fact it's important that a person is exposed to a series of highly intense stresses before he or she will develop a post-traumatic stress syndrome. And I think if we're looking at the journeys that these refugees are going through, usually from the experiences I have of those coming here to Germany, I obviously don't know about the journey to Australia, but they are en route on average around 12 weeks, 3 months. So that's a very long time to make a lot of experiences. And what's added on top is the personal evaluation of these events. So if I speak to a woman who's been raped, but hasn't considered that rape so bad, given that other things that she's seen or heard, then this might not be a high intense stressor for that woman, because she's given that event a certain meaning. Yet another woman who could have faced exactly the same situation, for her it could have been devastating So there's no objective way of saying this event is more traumatizing than another. It depends on both the personal evaluation of the intensity of the event, but it's definitely a question of amount. So the more stresses, the more often bad things happen, the more likely you develop a post-traumatic stress syndrome. So I don't like to narrow trauma down to one particular definition, but I think the key characteristic of trauma is that a person has experienced a catastrophic event or a series of catastrophic, terrifying events that leads that person to not be able to cope with everyday life normally. And resilience is then the contrary of this. So if a person has faced the same series or a highly intense, traumatizing, catastrophic event, but is able to cope with reality and everyday life normally. That's a very general and very rough definition, but I think within this we have to be taking into account a lot of other factors that can be part of the definition of trauma but don't have to be. So in a clinical diagnosis it would be important, for example, to say this is a traumatic post-traumatic syndrome, that you relive the trauma, that you are constantly having flashbacks over and over of this trauma, that then you're also having difficulties, you're avoiding, you show avoidance behavior. So you don't expose yourself to situations like this woman was saying. She's been not going to the water for a year. She's been avoiding going to near water because it reminds her of the trip. So those are other characteristics that can, but I believe don't have to be part of a trauma definition.
To work on a healing process, is that a key factor that you get them early?
So that you engage in the process quickly?
Yeah.
I think yes, because as I said before, the relationship between self-efficacy and feeling in control over one's life has a very, very strong connection to mental health. And the faster you can get a person to feel that they are able to get their lives back in control, the faster you can get them into healing and a successful healing process. If it takes 2 years of feeling out of control, then I think the process will be much more difficult to. Yeah.
And do you find that is recognized by officials, that is really important to get behind, to not sit on the problem for as long as I imagine refugees sit upon here in Germany before something is done?
Mm. It depends. I think it really depends. I think the institution, I mean, it's not purely a question of medical professionals. I think it's a societal question, it's a political question. And obviously, I think the worst thing we could have done is put these people in these big detention centers, in these big camps, in thousands and thousands, and instead of just having a system, install a system where they can faster get more in control of their situation. Having said that, there still has been a lot of very fast responses. I know on the part of Charité was between the 15th of September 2015 and the 20th of October 2015 that we've set up practically psychological and psychiatric hours for these patients in most of the Erstaufnahmestellen across Berlin. So the response there was extremely fast, and the list we have provided to our staff, our medical staff, was amazing because they were filled within a couple of days. All the shifts were covered, and that was all the doctors' voluntary times. So there has been, if there was a chance given to the people to respond quick, they were responding quick. However, we also know that things haven't gone perfect, and that a lot of them have been sitting there, and then things would just not move on. So they would not get into, for example, one problem we have, and we still haven't solved it, is that we haven't got the proper catchment system to know who these people really are. So if they move, we don't find them anymore, and psychological healing takes time. So if we only see them once or twice, and then they're being moved to a different camp, and we can't find them anymore, if we can't continue a process of like a history, a medical history with them, then they're lost and we lose them out of the system. And this, I think, is a tragedy we should have been able to solve. Yeah.
No prior research was done on the refugees before the journey, because they seemed as if everything was surprising. And my question is, if prior research was done before the journey, that would have minimized the stress on the trip, because they would have expected some things to go wrong, some things to happen along the way.
I think here we haven't gotten a lot of information about what exactly led these people to go. And I think maybe I'm not the only one who did wonder why he left his pregnant wife behind, why he would not want to wait, or why, and even now, why it's important for him to get his wife to come with the. We just don't know much about this person's motivation, but in other cases, and the people we see here a lot, the Syrian refugees, they haven't had that kind of. If we're assuming they had a choice, they haven't been given that choice. They left pretty much out of and this is we categorize traumatic flight in terms of pre-departure migration and post-departure aspects when we assume the gravity of their journey, and those pre-migration or pre-flight elements are exactly that. We need to know how much time did they have to plan for departure. Was it actually planned, or was it happening from one moment to the next because their cities were bombed, or because they were attacked, or because someone's life politically was suddenly under an intense threat of life. And so these are very important things to know. And when we talk to the refugees, this is something we always assess. How much time did they have before, and how well could they plan their departure? Because I think that's also an important factor that plays into how likely they are to develop post-traumatic stress.
Our deepest thanks to you for being here, and yes, I hope that your study will continue and
Strong.
Exactly, yes. Thank you.